The question I decided to do my 343 was on a paper 1, 2012. It's on telemedicine. The question is, in many countries, doctors are using video conferencing to treat patients remotely and to evaluate this medical practice. So for the introduction, I put that this eliminates the need for doctors and patients to travel in order to be diagnosed or treated. That it needs the use of internet to do the video conferencing or send files if it's recorded, and videos can be saved to be reviewed later on. So in the discussion part, I put the travel. For travel, doctors and patients will not have to travel long distances to be diagnosed or diagnose the patient. For keywords, I put internet connection because that's something they will need. And for new dimension, I put patients could be treated at any time, as time zones are different. So if a patient is in a time zone where it's 12 a.m., a doctor where it's 12 p.m. could be treating the patient. The equipment is identified, and some patients might not have access to sufficient equipment or might be unfamiliar with the computers. These are some keywords that could be used in the answer. And patients might not be comfortable using equipment as they do not trust or feel comfortable using it. For the connection part of it, I put that connection between the patient and doctor should be strong enough to communicate. These are some more keywords that can be used. And 3G and 4G will allow patients to access doctors when they are not home or in a location where they do not have Wi-Fi connection. For my evaluation, I put, for the evaluation of travel, there's no need for doctors and patients to travel, as I said before. And then patients in remote locations have access to experts around the world. The negative part of that is doctors cannot physically check their patients in remote locations, so that might be a limiting factor. Equipment, videos can be recorded and re-reviewed later on, so if a doctor doesn't have to, a doctor can always re-check the patient if he made a mistake or needs to just double check. The negative part of this is some patients might not have access to sufficient equipment. Some patients may not be familiar with video conferencing and are less willing to describe their symptoms online or on the video conference. The connection, if the connection is good, it will save time, allowing the doctor to treat more patients in one day. And the negative part of that is that a bad connection with the doctor and patient may be time consuming as they try reconnect with each other.